So suffering from low back pain. Hello, this is Dr. Adam Kopsky, and this week's topic of the week is on low back pain, but more specifically, what is causing your low back pain. And so I want to get a topic that is very common that I see is with a lot of patients, especially those older than 50 that come to the office, and particularly females. And so one thing that when we age that can happen in your low back is, I'm going to come a little closer, is here's just a segment of a vertebra in your low back. Here's a bone, and here's a bone, and here's a disc. Well, sometimes when we get arthritis that sets in the disc and even these joints back here, it can allow this to become unstable and slip forward like this. And so when we see that on x-ray, we call that a spondylolisthesis. Just means one bone has moved forward on the other, but typically what will happen in this is when this goes forward, it decreases this hole and can clamp on this nerve. So a lot of times when the typical presentation is people come in, they hurt an extension, because one thing that arthritic backs hate is going into that extension. So you never see people typically older going into extension. They're typically at Walmart when they're shopping, they're hunched over because they cannot go back into that extension because walking, standing, it hurts so much. So to get any kind of relief, they have to sit. And so one thing is, it's very informative, but a lot of times we'll typically take x-rays, because if we don't know that's there, then we can sometimes do more harm than good. And so we always want to make sure we got the right diagnosis off the front end, so your health is the #1 concern. So please tune in next week. I'm going to show a couple of exercises that I give my patients to really help stabilize this so it does not get worse, and hopefully help some patients get out of pain and improve their functioning. So hope this is informative. Please comment in the comment section below if you have any questions, and love to hear some feedback. Have a great weekend.